related set of questions related to South Sudan, and so if you guys, when you're presenting, can actually, help frame as best you can how the overall project as well as within the specific groups.
Yeah, so like Professor Eppenberg said, we are the group that worked with AVSI this semester, and we kind of had three very distinct groups within our one whole group. So Dominic and I worked on the conflict kind of part of the project. Beverly and Joshua worked on education and emergencies, and Rudy and Cornelius worked on absenteeism. And this was all for AVSI in South Sudan specifically. So we're going to go through the three different projects individually, and then kind of wrap it up at the end all together. So the first is the conflict one. So the overview of our project actually kind of changed a lot on kind of a week-to-week basis. We still had the same overall goal, which was conflict in South Sudan, but we had some different tasks that came up every week or so. But it was about a pilot project in community-based peace building, specifically kind of Catholic peace building. And there was a big research component that involved kind of providing some literature reviews or compilations of literature, I guess. And then we also kind of collaborated with some fellows at the Kroc Institute and the anthropology department.
And some of our project goals that did stay the same throughout the entire project was to help inform project design, because our specific project was in its kind of early developing stages. We wanted to provide a literature review and look at some data that would help inform the final product they were coming up with. And also, because Chris was in South Sudan, we were here to kind of facilitate the partnerships with ND faculty, because we could meet with them individually, and the time zone was the same, and so we could do that.
So yeah, one of the first things we did for Chris, our first assignment, was coming up with a list of authors who have already existing literature dealing with South Sudan, whether it be community-based peace building or just kind of intercommunal conflict or anything related to that. So these are the list of scholars that we came up with and presented all of their different works to Chris right off the bat, which he said was very helpful. Then we also looked at a couple think tanks and organizations which are listed below. And once again came up with a list and kind of a description of the works that they've done and the publications that they've released.
We also looked at some public databases, the ACLED database specifically, which is the Armed Conflict Location and Event Data Project, which is a public database that it has lists of all of the incidents that take place in a lot of developing countries, mostly in West Africa and Southeast Asia. And so we analyzed some of the incidents that took place in South Sudan, and specifically in the location that Chris wanted to look at, Quebec and Lake State, and provided him some of the information in the form of these charts and also some statistics that would be helpful for him and the organization, both for his own knowledge and for possibly presenting to others. And then we also, as one of our main things we did, we put together a peace building brief, because as Chris was looking to try to include more partners in his project and meet with more people, he found out that a lot of people didn't understand what peace building was, and specifically Catholic peace building. So he had us put together this overview and kind of a fact sheet that he would present to potential partners, and it includes some of the theological foundations and the tenets of Catholic peace building, as well as some success stories in South Sudan and other countries. And so we've been building that for him, and we presented it to him, and he's been hopefully using it to give them partners.
Yeah, and then kind of the last thing that we did throughout the course of the semester was kind of partnering with different ND faculty that are here on campus, since Chris isn't here to do that. So Professor Rahul Oka in the anthropology department, he was very hard to reach, but with the help from Professor Redenberg, we finally got to meet with him yesterday actually, and talk to him, because he's going to be doing some conflict mapping in South Sudan, hopefully within the next year. So we asked some questions on Chris's behalf that he's been wanting to have answers to for the last couple of months, so we relayed those to him last night actually. And then we also just kind of compiled a list of ND professors who are in the poli-sci, anthropology, and peace studies departments who do work that's related to intercommunal conflict and peace building and things of that nature. And then when we built that briefing that's on the last slide, we kind of reached out to a professor in the peace studies department to get his expertise on Catholic peace building. He particularly worked with that.
Who was that?
I don't know the last name. I will get that for you.
Okay.
George
Lopez.
Yeah, I think so. Yeah. Okay.
Yeah. So some of our challenges, because this project was in its very early stages when we were thrown into it, we didn't really have a specific kind of end product that we were working on, so we kind of had to be learning things as we went and kind of figuring out what Chris and AVSI wanted on a week-to-week basis. And also because we didn't really have a final product that we were submitting at the end of the semester, we don't really have goals for how we hope things will be implemented. We have goals for how we hope things have and are being implemented. So we hope that we provided information that has been useful for informing project design, and we also hope that some of the things that we put together and some of the things that we've been able to do in meeting with professors have been able to secure partnerships that will help make this project successful.
Thank you.
So Joshua and I focus on the education and emergencies part, and so AVSI is currently working in South Sudan, and as they're transitioning out of war and conflict, their goal is to find a way to provide education that is more long-term and has more of a recovery program implemented into it. So in order to help them with this, Joshua and I looked at two models that were common throughout a lot of the organizations who were providing education in a recovery setting. So two of those models were community organized primary education and accelerated learning program. And so both of these models, one community organized primary education really involved community members. And so we thought that was integral for having this be a long-term educational thing. And then also with the accelerated learning program, there were definite ways you could measure the success of that. So those are the two models we looked at.
One second. Okay, sorry about that. Sorry.
Oh, yeah, so the first model that we looked at was the community organized primary education. The first case study we looked at was specifically CARE, the organization CARE in Afghanistan. Some of the challenges they faced were gender inequality, family income inequality, distance to schools in rural areas. So as Beverly was saying, kind of the overall arching goal of this was finding this transition between education and emergencies was more just about getting kids in school, transitioning to early recovery, which is focusing on standardizing education and emphasizing the quality. So those goals kind of reflect that, first of all, just increasing enrollment and access, and then along with that, maintaining standards of quality. And then finally, this whole explicit piece of transitioning into the government school system as kind of the long-term goal. Some of the action plans that they were implementing was a specific thing which we'll talk about a lot, was this village education committees, which was a local-based, community-organized leadership group that was able to provide material and human resources. And you can go back to Professor Sarah Sievers, which she was talking about the whole model of focusing on the most vulnerable members of society. These organizations would come together and decide who is the poorest, most disadvantaged members of society, and provide education for them free of charge. And along with this action plan, they had standardized testing and teacher training, along with a gradual activity-based phased-out strategy, which is focusing on making sure that the government didn't take over right away, but that waiting until the government had the capacity to take over and then making it a gradual process. As you can see here, some of the evidence of success for their program, as enrollment definitely increased. It's also significant looking at the flattened out pieces towards the end. That's where the government phased out strategy took place as the numbers flattened out as the government started taking over and people started transitioning over to the government public school system. Finally, the transition aspect. One aspect that was really significant was the idea of continuity, going back to the village education committees that were very much involved in the community education process, transitioning to parent-teacher associations as the school systems integrated into the government school system. And as mentioned before, the switch was made only after the government could ensure that it had the capacity to maintain a similar, if not higher degree of quality education. The second case study that we looked at briefly, not in detail, since you said the children in Afghanistan focused on access, quality, and capacity, as kind of just mentioned.
Okay, so accelerated learning programs is the second aspect or model I looked at particularly, and so an overview, this accelerated education programs was a coordinated effort by several organizations, and they came up with a definition of what that looks like, and basically their goal is to provide educational competencies to people primarily between the ages of 10 to 25 years old who have missed prolonged periods of education. So with accelerated learning or education programs, key players are teachers and Ministry of Education, and they actually have a way to determine, integrate students who go through this program back into public school systems by working with the Ministry of Education and matching up kind of the standard educational exams that are taken at the public school level. And so the structure of the education systems that have been provided in different countries has been really flexible, but with most of the programs, they have 4 core subjects: language arts, math, science, and social studies, as well as complementary subjects. And so the complementary subjects also, in addition, facilitate with their social and psychosocial development, as a lot of these people in the program are displaced people from war conflict or children who were former child soldiers. So the first case study I looked at was Liberia, and specifically UNICEF's response in implementing an accelerated education program. So Liberia was in the midst of like a long civil war. 80% of their schools were destroyed, and 58% of children who were supposed to be in primary school were not. So like they implemented an accelerated learning program in which like 3 years of the primary school education was compiled into just 2 years of education. And so with this program, they were able to reach 250,000 learners, though only 3% annual increase from the 2 years they had. The program implemented was seen, they were able to reach like that many learners, so that was pretty significant. In addition, they had the West African Examination Council exam, which is also taken at like the public school system level, and they were given to these students in the accelerated learning program. And they saw that their results from both like the public school system, children, and the people in the accelerated learning program were comparable. So the second case study we kind of briefly looked at was in Ethiopia, and it was done by Save the Children. So Ethiopia had been in a severe drought, which led to a food crisis. There were many refugees who were displaced in camps, and a lot of children, 65,000 children between the ages of 5 and 11 were out of school. So in taking on their education, their accelerated learning program, they were able to reach, like go to scale and reach 222,759 students. So kind of the benefits of accelerated learning program is it involves like an integrated community effort. There's a way to measure its success and looking at, okay, like are these students actually able to integrate back into the public school system with the examination they take at the end. And it really places a preference for children who have been displaced, young mothers, and children who are ex-combatants. Some of the challenges associated with this is developing a curriculum and teacher training, monitoring, absenteeism, which the next group will kind of touch on. And then, so possible solutions include partnering with the Ministry of Education, because that's very important in measuring the standards, and also community partnership.
To kind of just sum it all up, as kind of mentioned before, kind of as a proposal to AVSI, something that they might take away from this case studies that we've learned. Is first of all, this whole concept of a village education committee that would be able to help, especially with this transitional aspect of serving a sense of continuity, providing educational access, but then eventually transitioning into a government school system. Also teacher training programs, something that AVSI has already begun to do. There's a St. Mary's University in the capital of South Sudan that AVSI has been working with, so helping to expand that, putting greater emphasis on that, especially with the transition piece. And then finally, the accelerated learning programs, which details have just been shared before.
Great. Thank you.
So Cornelius and I work on the absenteeism project for AVSI. Our project goal is really just to look at the existing literature reviews of cases to see what actually works in addressing absenteeism in developing countries, because it's a really classic challenge. There are many research that are trying to address the problem. And like in our presentation, we're gonna give a brief overview of South Sudan context and introduce what we found in the education sector and health sector.
So as Rory mentioned, we were dealing with a topic that has a lot of literature. So I guess one of our first challenges to kind of come straight off the bat was trying to figure out how we would create filters that would really apply to South Sudan, especially because Chris and the AVSI team are just trying to establish a baseline of research here. So these are some of the things we're going to kind of walk through, and we have to develop systematic literature reviews. And we are supposed to make some adaptations for existing projects, but obviously because we don't have a lot of context, that's really, really difficult. So we've had to rely on Chris a lot there. So just kind of give you a background on the actual situation. So as Ruben mentioned, absenteeism is a classic challenge in development, particularly in South Sudan. So the big problem for us is that there's no non-payment of salaries. So as you might imagine, it's very difficult for these teachers to stay very motivated and for them to be continuing to come into work every day. There are also two other issues that Chris really highlighted, which was food insecurity and physical insecurity. As the previous team mentioned, South Sudan is currently transitioning out of conflict, so education is at risk and it's not always safe to be going to school. So there are many different factors that we had to kind of play with here and kind of work through to make sure we found relevant literature. Within the education sector specifically, there were two really interesting recommendations. So there'd actually been already a lot of literature reviews, or one particularly, that had looked at what worked in absenteeism in developing countries. And what they did is they did a really clever thing. They basically broke it down into two different types of interventions. So one is the actual direct intervention. So, hey, I'm going to be implementing this strategy to directly combat absenteeism. And the second is the indirect intervention, which is I'm going to try and focus on student achievement. And as a byproduct of that, we might be able to reduce absenteeism. Given the work that the Education and Humanities team did, Ruben and I thought it would be a really good decision to actually focus on the latter, just because that way we might be able to actually bring in some of the other absent projects. So as we've seen so far, it's very interesting. Community involvement is really a key part of actually any absenteeism intervention that's really going to work. So we immediately looked at any intervention that could not offer a monetary incentive, because right now, effectively, teachers are facing a 6-month delay in actually receiving their salaries. So we wanted to focus on, effectively, interventions that didn't include monetary incentives. And so the most successful ones that we found were ones that basically created accountability within different communities at very small levels, and basically allowed different parents in the community to actually monitor teachers, to make sure they were coming in and actually doing their work.
Following that, we're just gonna give two brief examples on community involvement. One case we found that's really interesting is offer small incentives that requires a small amount of external resource, which is to offer scholarship to the girls in the developing country. And girls are then motivated to come to the school, and parents and community will have some hope for them, which in turn motivate the teachers to come to the classroom. And the second case is actually brought up in the design thinking document. It's like train local women, I think it's by the Rock Institute, train local women who are not educated to teach those students. And that actually works through a really well-designed structure. We haven't really examined the specific of the project, but so we primarily focus on the education sector in our previous research, and we just interned into the health sector. And our preliminary research found there are several things we can potentially look at. The first is macro-level interventions, which is focused more on healthcare system. One particular strategy that works is to improve planning, deployment, and use of health workers. A successful case is when both donors and the government commit themselves to a plan to address those issues. The teacher attendance will, the health worker attendance will improve. And second is micro-level focus on job satisfaction. A case shows that a supportive manager may be able to reduce the negative effects of a poor working environment. We haven't really got into the details of the project, but based on the data, there is a significant increase. And the third one is individual level, which is to, I think this reinforces the second micro level job satisfaction, which is create network in the community and really use the staff to influence other staff.
Then just to wrap up, so one really cool thing about our project is that we thought it really closely related to the work that Josh's team are doing with regards to education in emergencies. So when we're looking to reduce absenteeism from AVSI's perspective, we think they really can kill two birds with one stone. And a lot of the different community involvement initiatives that the other group looked at, we think would be really effective here. And so the two kind of case studies we kind of looked at were the advanced education program for Save the Children and also the case study for Care Afghanistan. Because we believe if you can involve the community and create accountability between the parents and the teachers, you will take some steps to not only creating education systems that can last during areas of conflict or times of conflict, but also will actually create a better education system for all teachers and schools.
That's it? Okay, great, thank you. So, a couple quick questions, comments? Yeah, Brenda.